Last year, over 1,000 people in Massachusetts died due to opioid-related overdoses. That's a 33% increase since 2012 and part of a nationwide spike in prescription painkiller and heroin-related deaths. Connecting Point contributor Carol Lee McGrath went to Franklin County, to the town of Montague, where Police Chief Charles "Chip" Dodge is using social media to ask citizens to help dispose of potentially dangerous used syringes being left in the streets, a sign of the depth and reach of this addiction crisis.
Kelly Letomacki takes a walk on a recent warm evening with her boys, 10-year-old Caden and 8-year-old Mason. It's nothing out of the ordinary for the Montague family, but a few weeks ago, their usual walk took a surprising turn.
There's a big stretch of field off Montague City Road. My younger son had gotten off of his bike and decided he was going to look at something on the ground. And just as he almost touched it, I realized what it was. It was a needle, and I quickly yelled at him not to touch it and please step away from it. And then he had a bunch of questions afterwards.
Kelly is not the only mom in town answering those types of questions from children. Police have responded to 20 calls since January about hypodermic needles tossed in alleyways, on sidewalks, and even by swing sets. It's become such a problem that Montague Police Chief Chip Dodge has asked for the public's help.
Over the last few months, we've been receiving numerous phone calls reporting needles being found in various locations around the downtown area. As a result, my officers are constantly responding to pick these needles up. This takes them away from other calls, and it also concerns me because sometimes they may not get to that needle for an hour or two.
Chief Dodge sent out a plea on Facebook asking for the public's help in picking up needles. The father of two says he's worried about the children in the community. He says a 2-year-old recently found a needle and got hurt.
And somebody just happened to be, using in the alleyway, and they threw the needle into the yard. Unbeknownst to the family, they go out into their backyard. The child goes to play on the swing set, finds a hypodermic needle. The family wasn't even aware that it was there because they're not that big. Next thing you know, a child's crying, and the child's got a hypodermic needle stuck in them.
The Solid Waste District donated sharps containers, and local businesses have been putting them out.
Once the needles are placed in this, the next stop is to be incinerated.
Chief Dodge says the plan is working. The police department has not received calls lately about tossed needles, but he says this problem is one of the many fallouts of what's been called a heroin epidemic in Franklin County.
Over the last year, we've noticed this heroin epidemic explode. What's happening is, this is my feeling, is the doctors are prescribing opiate medication to help people with an injury. People experience this euphoria from the opiate medication. Once they heal and they come off of the medication, they still want that feeling. They want that euphoria. Now, to buy pills on the street, it's very expensive, as opposed to a $5, $10 thing of heroin that's injected directly into the bloodstream. They're getting a way better feeling, quicker, and very cheap.
Law enforcement officers say the drugs come from the border, then they go up to New York, then to Hartford, up 91 to Springfield and Holyoke. And they say that traffickers look at these small towns in Franklin County as targets of opportunity.
The smaller communities, it's generally thought that the police departments are small forces and they're not able to keep up with the problem. And so these small communities are easy prey.
To fight back, the communities of Franklin County formed the Opioid Task Force in 2013. According to reporting from Franklin County first responders, there have been 50 suspected overdoses since January. 8 of them were fatal.
There's an average of 1 opioid prescription per resident in that town.
Marisa Hebel, who has a background in public health, is the director of the task force, which has grown to 300 members and includes professionals from the courts, law enforcement, the medical community, and local schools. Their mission is to prevent opioid and heroin addiction and to get help for people who are hooked.
We know that most people who develop a heroin addiction have prescription drug misuse and addiction in their past, and so we're really working around the access in the community to prescription medications.
Hebel says the task force has been working to secure more detox beds and beds of clinical stabilization in Greenfield. She says the closest place for people desperate for help is Holyoke. In addition, many of the local firefighters and paramedics, including those in Montague, are now carrying Narcan, a medication which can reverse an opioid overdose.
Opioid addiction takes over so quickly, and we cannot help someone and get someone treated if we can't save their life.
She has seen firsthand just how destructive addiction is to families.
We very often see that a family that has an opioid addiction somewhere there is involved in multiple courts. So for example, they may be in district court because the young person or the person did something related to their opioid addiction that was against the law. They may be getting evicted because the addiction has taken over and they haven't been paying the rent. The grandmother may be in housing court because they need custody of the 2-year-old child. I can't say enough about the ripple effect and how important it is to intervene early.
And while communities are banding together to combat the problem, Hebel says with addiction, there's never a quick fix, which is why she and so many others are pushing prevention.
Opioid addiction can take hold very quickly with people, and it can be a very short time frame. There are some people that it can fly under the radar for a significant amount of time, and for some people it's a very short time frame before they're into some serious trouble.
In the meantime, small towns are dealing with these big problems the best they can.
The fact that it's closer to home where our kids are being brought up and where they play baseball and when they go play at the park, it's really scary. And now with everything else going on in the world and on top of this, it's just a real eye-opener to keep your eyes out for your kids, and you definitely have to start teaching them a lot younger than you thought you would.
Reporting for Connecting Point, I'm Carolee McGrath.